Medical Director of Fertility Specialists of Texas. Ling Chen is here. I have two members of our team that's here. Ling Chen, who is here, and also Marissa. And hopefully y'all will be able to meet us afterwards if you have any specific questions. I will have to say that I'm sorry that I had thought that actually there was going to be a screen where we could display our talk on the screen. I don't know if y'all can actually see this. Can y'all see? I guess y'all probably can't. I don't know if they can. I guess you can't. Maybe they can. No, okay. That's over here. So anyway, so we're a fertility practice in Texas. I know that one of the first questions that people ask is why Texas? A lot of times people don't think of Texas as a very gay-friendly state, and certainly in terms of surrogacy. And I would say that that it's always been very interesting to me because it actually, while there are parts of Texas that can be very conservative, that actually there's a lot of case law in Texas that has long protected surrogacy and made surrogacy very easy and straightforward for individuals that come to Texas. The other thing about Texas is that it is very affordable because there's a lot of companies that are coming to Texas, and I think that the reason why they're coming there is because it's not as expensive as it is in other places. The real estate's not as expensive, and the success rates are very good. So basically, the practice itself has a total of 5 doctors, but there's 2 of us that are really specialized in terms of working with patients that are surrogates, me and Dr. Score. Dr. Score is actually one of our recent doctors that has joined us, and both of us do a lot of surrogacy. Our main office is right across the street from the Dallas Cowboys, from their practice facility. It's about 8,000 square feet, and has a large IVF lab and genetic testing center. We are very involved in taking care of LGBT couples. We're all of our staff are very used to doing to the specific issues that may arise, and are very sensitive to the amount of time, effort, and quite frankly, financial investment that you're making in terms of this process. One of the reasons, or one of the questions that often I'm asked is why Texas, and I've outlined a couple of the issues, but I would say that one of the most important issues is really success rates, and that is that we have a good IVF laboratory, and that makes a big over 1,000 IVF procedures last year, with about anywhere between 70 to 90% of those using pre-implantation genetic screening, where you actually biopsy the embryos. If you are using an egg donor and a gestational carrier, the success rate is about 70 to 75% when you transfer one embryo, and the rate is a little bit over 50%. My recommendation is to transfer a single embryo because it's definitely the most safe way of achieving a pregnancy. With twins, obviously, you probably have learned that the main risk is really that you deliver early, and so there's a higher risk of preterm labor and gestational diabetes, and it's harder to find carriers that'll allow you to transfer to. But if you understand those risks, we certainly are willing to do that. But our recommendation is certainly to transfer one embryo. Our embryologist is a PhD embryologist. There's a staff of 4 other embryologists that all they do is IVF, so we do certainly have a lot of experience in terms of doing IVF. These are just some pictures of the laboratory that's involved. In terms of the process, typically, what does it involve? Really, it only involves coming to our facility one time, and that is that we would typically Skype before then, just to kind of get information. A lot of times you could be in contact with Marissa or one of our coordinators before, just so we have information about you. And then when you come to Texas, you would be, depending on whether y'all are doing split insemination, in other words, if you're planning on you and your partner both contributing sperm, then you would freeze sperm, and then you would have blood testing, and then there's consents that you sign. The second step is really picking out an egg donor. We have an in-house egg donor program, and we also use agencies. I often tell people that if you're looking for someone that's 6'4" and has like an SAT score of 1800, we probably don't have that. We probably don't have that person. But we certainly work with a lot of agencies, both in Texas and outside of Texas, that can help you pick out a very important part of the process, and that is, someone that you're comfortable with, that's going to have, that's going to be a that your child's going to have those genetics that are going to be involved. But we screen them the exact same way. We check their driver's license to make sure the information, adds up. We do drug screening, toxicology screening, psychological screening, genetic screening. They're tested for over 200 different genetic mutations, and then, and only then, are they allowed to go through. We are a member of GPAP through Men Having Babies. I think that one of the, obviously, the financial part is not a trivial part of this, and that it definitely is, and it's always amazed me how much, people, the cost of this process. And so I, and our staff have been very attuned to that and realized that you're making a significant investment in a process that, that requires a high attention to detail and hopefully something to show for what y'all have done. We do have agencies, like I said, with egg donor agencies, as well as surrogacy agencies, because typically after you would pick out an egg donor, then you would also, we would direct you, we could refer you to several agencies from a surrogacy perspective and help you do that, because after you've picked out an egg donor, we do the screening, then we're going to create embryos, and then hopefully not long after that, then we can have already seen the surrogate and done the screening for the surrogate. Oftentimes you would meet the surrogate when you came to our clinic, to maybe go to dinner with her the night before, and then and we can, and we can be screening her while you're creating the embryos, because we want to, because the fun part of it is transferring the embryos and making a baby. Making all this come to fruition. We do have a guarantee program. If some patients are like, if you're like saying, God, it's it's a lot of money. I'm worried that I've tired people that have said that, they had nothing to show for it when they're done. We do have an IVF guarantee program that covers the cost 100% having a baby, not a pregnancy, having a baby. So that means a live birth. And I think that is certainly one thing that distinguishes us, because results matter, and so we try to have that reflect in terms of not just show you, not just in terms of what we say, but actually in terms of what happens. We talked a little bit about your first visit. These are members or coordinators of our team. We have case managers who basically that you would be in contact with. They would basically hold your hand and walk you through the process, because it does require a lot of coordination, and it's important that you know what's going on, so you have an idea of the process. Again, after we've seen the egg donor, we make embryos. Let's say you start off with, typical average number of eggs is 17. The range is between 10 and 25. Then you can typically expect, let's say you started with, 20 eggs and 18 fertilized, and then on day 3 that could be 13 embryos, and on day 5 you should have at least 2, and anywhere between 2 to 4 or 5 that are frozen. At that time is when the embryos are biopsied and sent off, and about a week later you get a report. The report is 1, 2, 3, 4, 5, normal, abnormal, and the sex if you want to have that information. And then after we have that information, again, we've seen the surrogate, and hopefully we can ultimately do the transfer to make a pregnancy. A little bit about myself. I think I may have talked to you a little bit before. Is that I have two boys that are 12 and 14 years of age, and I think that that one of the reasons why I went into this field is because I think that kids are amazing, and they change your life, and I think that you should have that the opportunity, and hopefully in a seamless way, like anyone else. And I think that when you talk to people that have worked with our practice, they see that it's reflected in terms of what we do. And so we hopefully I can. If you have any specific questions, I'm available to talk later on later on today or early tomorrow, early in the morning tomorrow. But certainly we would be, me or any one of the members of my team would be happy to answer any specific questions. No questions at all? Yes.
Do you have Chinese egg donors in your in-house database?
We,
One.
okay.
Half, yeah, she's half.
就是半中国人，对他有中国的血统有一个，然后另外一个是越南裔的。
But we definitely had patients that are, that there's agencies that we use particularly. For example, one thing that seems a little bit odd, but for, like we have, if you pick an egg donor that's like in California, there's certainly some agencies on the West Coast and East Coast that specialize in finding Asian donors, and we'd see the donor, okay, we would review her records. She would then start her stimulation and do all that wherever she's at, whether she's in New York or Los Angeles, and then she would come to Dallas a couple days before the retrieval, and we'd aspirate the egg. So it's like that. Proximity is really not that, it's not that important. Obviously, it definitely makes it easier if they're right there in terms of screening. But we see donors from really all over, all over in terms of that have their screening done in an outside clinic, and then they come to us for the retrieval. Other questions? I think that again, if y'all have, Marissa's able to, because financial, the part is a very, well, we're not supposed to, okay. I was,
大家有任何问题都可以就是下来可以问。
What's the duration of the so-called guarantee program? And do you have like a success rate on that program as well? Because the number we have is like for IVF only, right?
in terms of,
The duration.
well, so we have the in terms of patients that are using, we have success rates in terms of patients that are gone through, using an egg donor in a gestational carrier, and those success rates hold true for the IVF, for the IVF refund program. I would say that, we offer that program because there are some people, particularly if they've had like a bad experience in the past, that they're like, I cannot go through and lose a fair amount of money, and I want to have that sort of guarantee. But the fact is that I don't actually encourage people to do that, because when you're using an egg donor, when you're using a gestational carrier, if you do the first transfer, let's say you do the first transfer, you transfer a single embryo, everything is on that one embryo, and it's certainly not a guarantee. It's 70%. So that means that that 20%, 25% of the time that you transfer it, even a beautiful looking embryo, and they don't get pregnant, but they have other embryos frozen, and so you thaw one of the other embryos, and they inevitably get pregnant with one of the other, with a frozen embryo. So it's exceedingly unlikely, and it's not all the time, but it's exceedingly unlikely that you're not going to get pregnant with your first transfer or your second transfer. I mean, if you ask me, does it always happen that way? No, because it's like that. There's obviously different things that happen in terms of stimulation, but I'm saying that we have not had, in terms of anybody refunding that have used an egg donor gestational carrier, we have not had to, refund those anybody in that that's done that. Other questions? Most,
Yeah, so can you tell us about some major difference between the laws in Texas and between?
well, I think that I think that it's worked out. California has always been one of the first places that have a lot of times it's like where things start off and then it kind of comes across the country, and I think that in particular, for example, a lot of patients that are coming from China, and we see, there are 3 flights actually a day that come from, Beijing, Shanghai, and Hong Kong, and so there's been there's many more people coming to Texas, and in terms of the safe, again, I'm not a lawyer, so I can't tell you, but it's like that they're, I'm not aware of any issues in terms of particularly since the law changed in the United States for all states, of patients going through in terms of getting both names on the birth certificate, you know, getting pre-birth orders or anything like that. I'm not aware of. We have lawyers that we use that are very familiar with the IVF laws, and so we have not had an issue with, you know, with that, and so I couldn't tell you anything specifically about that. But there really has not really been, you know, there have not been any issues.
Sorry, is there any risk that the surrogate mother like gave up halfway? Like,
Pardon me?
Like any risk like the surrogate mother gave up halfway? Because I have my friends who had this kind of back experience.
The surrogate mother to give up halfway?
Yeah.
The surrogate mother fills out signs a contract as well, and so and it's a legally binding, you know, contract. I think that it's hard to get somebody to, you know, I think first thing is it depends on the screening. Like, so if particularly like if you use an agency that does their work up front in terms of screening people, then you don't really have that issue because they're very good at finding people that are not going to be doing that. I mean, you can't really force somebody to accept an embryo, but it's like that it would be really unlikely for that to be the case. You know, so we have not had that, you know, that happen. There are some times that you, in the course of going through, when maybe you discover something about the surrogate that you're later saying, you know what, I don't think we want to use that person anymore, or she goes through 2 or 3 transfers and, you know, and there's a problem, and so you're like, I don't think you should waste any more of your embryos with that individual, but it's like that's different than her saying, you know, I'm done.